So, okay. So today I'm going to talk about missing data in global health and why it matters. I think this could be pretty useful for you all just from a perspective of thinking about the implications of statistics and the data collection and research that you might be involved in, and why it matters on a larger scale. My name is Saloni Dattani. I'm a researcher at Our World in Data, and I'm also a co-founder of an online magazine called Works in Progress. This is my email in case you need to contact me. So just to give a little background, I do lots of research on different topics in global health. I work at a nonprofit organization called Our World in Data. We have a website where we present data and research on the world's largest problems. So the goal is basically to share public data and research on these problems to help people understand these topics, how to interpret them, and use this data for their own research and work. So we have a lot of different articles, a lot of charts, and these are on various topics such as energy, poverty, and global health. And what I've realized from working on these areas is that global data comes with a lot of uncertainties. Data is collected in different ways. It's limited in a lot of ways, and it's limited in a lot of countries and for different reasons. And so this talk is about one of the biggest topics in my area, which is the causes of death. So I'm going to talk about why data is limited on this topic, what implications that can have, and share a few ideas on what to do about it. I'll start off with an example that you probably know of. So this is a recent report from in Nature about how many deaths were caused by COVID during the pandemic. And this is trying to show the number of deaths that might have occurred from COVID in India. And so the blue line shows the number of confirmed deaths from COVID. And the orange line shows the excess number of deaths, so the additional number of deaths compared to the previous years. And you can see there's a massive gap between those two estimates. And in fact, if you zoom out to look at the entire world, you'll see a similar picture. So the number of confirmed COVID deaths up to March was around 7 million. But the number of excess deaths compared to the previous years was more than 20 million. So what accounts for all of these missing deaths? What was causing them? Or how do we know how many deaths were actually caused by COVID? So there are two key messages that I take from these two charts. The first is that there's a lot of uncertainty around how many COVID deaths actually occurred. The second is that even the lower bound estimate of the excess number of deaths is almost triple the number of deaths that are confirmed as COVID. So just taking a step back on how this problem might have arisen. Why are we missing this data in the first place? So to understand this, I think we need to think about how we actually know what people are dying from. And this is a procedure that is typically carried out when someone dies. So when someone dies, a healthcare worker, like a doctor or nurse who took care of them, fills in a death certificate. If they don't have a doctor or nurse who took care of them, then a coroner might investigate their cause of death. They try to fill in this certificate with information that they have on the person's deaths and the steps that led to their death. And that stepwise process goes backwards, and they try to figure out what the underlying cause of death was. So the disease or the condition, or maybe an injury or some event that eventually led to their death. Then all of these death certificates are collected by the country's civil registry, and the underlying cause of death is turned into an ICD death code. So for example, someone who dies from tuberculosis is given the code A15. Then once a year, all of the death codes in the country are sent to the World Health Organization. So that's a typical procedure. unfortunately doesn't always go as planned. So many deaths aren't registered at all. There's no certificate for them that's filed into the country's civil registry and shared with the World Health Organization. This is a map that shows the share of deaths that are registered in different parts of the world. As you can see, there are some countries that have very high levels of death registration, above 90%, but there's also a lot of the world that has very little to none. So even in countries where there is a civil registry, not all deaths are registered. Now, even among the deaths that are registered, many don't have a cause of death listed on the death certificate. So now this shows a subset of that previous map, where it's looking at the share of deaths where there's a cause of death given to them. And you can see that even in the countries with death registration, not everyone is given a cause of death. So for example, in India, around 80% of deaths are registered, but only 10% are registered with a cause of death. And because of this, most of the world lives in countries without cause of death data. So this shows the world population in different countries. So each bar represents a country. And if everyone lived in a country with death registration, the whole chart would be filled. But instead, we have only around 1.5 billion people living in a country where everyone's death gets registered. So this is a map where you see how many countries have enough death registration and report it to the World Health Organization. So this is countries where at least 65% of the deaths are registered with a cause of death. And you can see that a lot of the world is not included in this map. Even among the deaths where there is a cause of death given on the death certificate, many of them don't have a precise cause of death. So this is a map that shows the percentage of deaths that have an imprecise cause of death. What does that mean? It includes things like chest pain or sudden death or cancer of unknown site or events of undetermined intent. So these are things that might be listed in the death certificate when the doctor or nurse doesn't know what their cause of death was. And this map shows the percentage of people in each country who have one of these ill-defined causes of death. So why does this happen? Is this a recent problem? This is a chart that shows how different countries have expanded their civil registries over time. So the number of countries with any civil registry over time is shown in the first dashed line. So you can see that civil registries and population registers are fairly modern. The first country that had one was Sweden, and there are still a lot of countries that don't have a population register, which is the last dashed line. So many countries still don't have this, and those are especially in Africa and parts of Asia. And the alternative to knowing about using a civil register where you have death certificates is by using a census. But censuses don't collect data on the cause of death, and they also only take place once every 10 years. So in between, we have a lot of deaths that are missing, or we have to kind of estimate how many deaths are occurring, or we have to use a civil register. So in total, many deaths aren't registered at all, as we saw. Even among those that are registered, many aren't registered with a cause. And even among those that are, many of them lack a precise cause of death. So this is a bar chart that shows how this process goes along. So in 2016, for example, it was estimated that about 56 million people died worldwide. Out of them, only about 15 million deaths had a cause of death registered and reported to the World Health Organization that was a precise cause of death. And you might wonder, how do we even know how many deaths occurred in that year. Well, that's just an estimate based on things like the census and trends over time, the number of births, and so on. So you don't have a very clear understanding of how many people are dying worldwide. And that's one reason why we had that problem with the excess deaths that I showed you in the beginning of the slideshow. So why exactly does this happen? Why is there so much missing data? Why aren't the deaths getting registered? This is a problem that has many different causes. The first is civil institutions. Many countries just don't have a functioning civil registry where births and deaths are actually recorded. There might be legal factors. So, for example, in some countries, not having your death registered doesn't have any legal consequences. So there might just not be enough reason for people to actually have deaths of family members registered, for example. Sometimes it's because of labor, health, infrastructure, and technology. A lot of countries lack doctors, hospitals, testing, and medical records to determine what each person's cause of death even was. And finally, there might be cultural factors. So some causes of death are stigmatized, like AIDS and suicide, and those might be misreported as something else or something imprecise. I'll just focus on one example to just illustrate how large the problem can be. So in a lot of the world, many people die outside of hospitals. This is a chart that shows the share of deaths that occur at home. And as you can see, in a lot of countries, most people are dying at home. And what that means is that they don't have a doctor or nurse who can easily write down their cause of death on the death certificate. They might need someone who has taken care of them in recent years, or they might have to have their cause of death investigated by a coroner in that case. And even this map, which I tried to find, is just showing rough estimates. We don't actually have a great idea of how many people are dying at home. The data for this map, for example, comes from only 49 countries between 2005 and 2019. And then all of the other countries have been extrapolated based on that. So without a doctor or medical records, if someone died in a hospital, they might not be given a cause of death on their certificate. And a lot of countries also lack coroners or autopsies to understand what their cause of death was. So if this is the case, how do we even know what people are dying from worldwide? How do we have all of these charts on our world in data that show 1 million people are dying from tuberculosis worldwide, for example? We often have to rely on other types of data sources. So this might include subnational studies and surveys. We might have to look at excess deaths compared to a baseline, as was done for COVID. So during COVID, this might have included looking at household surveys or looking at the number of burials that occurred during those years and then comparing those to previous years. This doesn't really work in every case. It's appropriate when there's some kind of new factor that emerges and you can attribute the excess to some new factor like an epidemic or a natural disaster. And you might also lack the knowledge or data to know what the baseline was. Maybe you just didn't have any records from previous years to know how much that excess turned out to be. You could rely on estimates from other countries. You could compare their income levels or their climate or age structure, depending on what the cause of death was, and try to estimate the number of deaths based on that. The problem with doing that is that maybe those similar countries also lack good cause of death data. So how are you going to extrapolate from that? And fourth way of finding out what people are dying from is another method that I want to discuss a bit further, and that's called a verbal autopsy. What happens here is you interview relatives and you find out what they know about the person's cause of death. So one big example of this is a large study called the Million Death Study. This was conducted in India across a period of 15 years, and it was nationally representative, occurred across the country. They had 2.5 million households interviewed once every 6 months over this period. And the people in these households were asked about their deceased relatives and the symptoms they had before they died. Using all of that data, there were 2 doctors at least for each person to look at their answers and try to figure out what their cause of death might have been. And then the results from that were extrapolated to the rest of India, which is 1.3 billion people in 2014 when the study ended. This was a relatively cheap study to conduct. It was $2 million per year, which is about $1 per household. And that was possible because India conducts a lot of household surveys as part of the census and other data collection procedures. So I'll just share a few results from that study. One thing that they found was that infant and child mortality declined over the years across different causes of death, different regions, and between girls and boys. So you can see this in these 4 charts. Another thing that they found was that the causes of death tended to be different for people who died in hospitals or at home. So in this chart, you can see in different colors the share of deaths from different causes, whether they happen at home or in the hospital. So for example, if you look at tuberculosis, around 11% of deaths that occurred at home were caused by tuberculosis, whereas in hospitals it was only about 7%. And you can see that there are disparities in other causes of death as well. Finally, one of the most interesting results from the study was something unexpected, which was that about 46,000 people were dying from snake bites in India per year. This is a map that shows the risk of dying from snake bite in different parts of India. So this was really surprising because the World Health Organization had previously estimated that only about 11,000 to 15,000 snakebite deaths were occurring per year in India, and the Indian government had only recorded around 1,000 deaths per year. In contrast, this study estimated it was more like 46,000, which is much higher. And what they found was that about 94% of those snakebite deaths were happening in rural areas, and 77% of them happened outside of hospitals. And what that means is that around 1 in 250 people in India were dying by snakebite by the age of 70. This led to massive revisions to the World Health Organization's estimates. They previously thought about 50,000 people were dying from snake bites worldwide per year, and that turned out to be roughly the number that was happening only in India. So the new estimate is around 100,000 deaths worldwide from snake bites, but that also comes with a lot of uncertainty, and it places it quite high up on the causes of death from different tropical diseases. So I'll just dive a little deeper into the specific example because I think it really helps to visualize the problem. Why were the estimates so far off, and how did this study do things differently? So one of the reasons was that the estimates that had previously been made came from non-tropical countries and urban areas. They usually came from hospitals. The government's records of the number of snakebite deaths, for example, were only including people who had a death certificate where snakebite was listed as the cause of death. And when you have estimates that come from other countries or urban areas, these are places where most people die in hospitals. These are places where some causes of death, like snake bites, are less common. And they're places where most deaths are counted. And what this means is that this kind of data is missing systematically, which makes it very difficult to extrapolate. I made this little direct acyclic graph in case people were interested, which shows how this data is missing. So you can see that snakes cause lethal bites. People with those lethal bites might try to reach a hospital. If they did reach a hospital, that would reduce the chances that they die from the lethal bite because they'd have more access to antivenom. And people who die after reaching a hospital are more likely to have their deaths recorded. But because these things are interrelated, reaching a hospital affects your chances of death and also affects the chances that your death is recorded. This means the data is missing, not at random. So there are still some limitations with these new estimates that we have from this big verbal autopsy study. The problem with verbal autopsy studies is that people might not remember or know the relevant symptoms before someone died. There might be a lack of medical records and testing, so they might not realize that some condition is relevant. And they might even misreport evidence. So in some cases, for example, with suicide or AIDS, they might misreport some of the evidence before the person's death, or in some cases, they might even be personally involved in the deaths, such as for violent deaths and homicides. Finally, studies don't include the entire population. All of these surveys that have been conducted so far have been a small segment of the population, either from a city or from a national survey. And then the results are extrapolated. These limitations have larger implications when causes of death are rare or if they're difficult to distinguish from each other, maybe because their symptoms are similar. And then the doctors wouldn't be able to figure out what their cause of death was with a high degree of confidence. But even though they have these limitations, I think they're a step forward. They give us some benchmark figures to compare other estimates to. They help us understand causes of death that occur outside hospitals, which aren't recorded. And they help to understand and improve estimates for other countries as well. So verbal autopsy studies have been conducted in other regions. This shows a map of where these studies have taken place. And they've also led to revisions of global estimates for other causes. But as you can see, there are still lots of countries where verbal autopsies haven't been conducted. And we also didn't have data from the usual procedure of death registration, which means there's still this remaining question of what we're missing and underestimating in other countries. Just to come back to the main point of why all of this data matters. If we're trying to understand causes of death, I think that helps to put all of their numbers in global health into context. It helps us to understand numbers per capita, rates of disease per 100,000 people, the percentage of people who are affected by any given health condition. It helps us in planning and decision making, whether that's by individuals, governments, NGOs, or private companies. It helps answer questions like which conditions are going untreated, where are doctors needed, how many doses of medicines and vaccines are needed, how much progress are we making, are new problems emerging? And even if these different estimates agree that if we have estimates already that agree that something is a large problem, if we're underestimating numbers by a factor of 5 to 10 times, that's a really big deal. So I'm just going to come all the way back to this figure from the start, looking at the excess deaths from COVID. And hopefully it makes a little more sense now why there's such a large disparity between the excess deaths that occurred during the pandemic versus the recorded deaths. And you can also see how much bigger that gap is in poorer countries. I've kind of looked at this topic in different areas. Causes of death is one of the biggest areas, I think, in global health, but it's a systematic issue. It's very widespread, it's highly unequal, and it can have large consequences. It doesn't mean that we don't know anything about global health. It doesn't mean that we shouldn't be doing anything. It's just an important thing that we need to remember, and it's something that we need to make more progress against. And if we have step forwards in collecting data through other approaches, we can improve other estimates. So these are a few things that I've taken away from thinking about this topic and what we should be doing differently. I think the main thing that's important here is to have more high quality underlying data and relying less on extrapolation when we don't know how to extrapolate that data. I think what's really important is to have routine and long-term data on these problems, not to have one-off surveys, but to be regularly collecting data on important problems. And hopefully this leads to more accurate and precise estimates and numbers that we can be more confident in. So just a few ideas of how we get there. I think different people can take away different messages from this. For example, people who are data communicators should emphasize data quality alongside the numbers that they're sharing. Data quality and assumptions affect how we interpret any values or any graph, just like having units on a chart. And I think researchers need to highlight how much data is missing, what their uncertainties are, what the gaps in knowledge are, so that other people can fill in those gaps. I think it's really important to deliberately go out there and study underrepresented populations who we can't estimate from other available data. And it's also just really important for countries to actually invest in collecting and sharing data regularly in the long term, whether that's by labor. In this case, that might be medical professionals or technology or institutions and health infrastructure to collect and share data regularly. And eventually, the goal there would be to have universal data coverage around the world and not just in a few countries. I'm also really interested to hear other people's ideas and suggestions on this topic, what they think I might be missing, or if these problems also occur in other important topics that I haven't thought about yet, or what ideas you might have for addressing it. And that's the end. Thank you so much for listening. Looking forward to